I'd like to request you to take your seats. And please, if there is an empty seat in front of you, if you don't mind, could you please move to that seat? We want to fill up the front seats first and then leave the other seat for the guys who come later. We're about to begin. We're expecting the Honorable Minister for ICT to join us in the next 2 minutes or so. Another announcement. I'd like to request the 9 founders from HTHA that are going to be on today's panels. Please make sure you find a front seat, the front row, in case you're seated at the back. I still can't see all the 9 of you. I hope you're somewhere on the front row. Good morning to you all. Thank you so much for honoring our invitation to this session. My name is Emmanuel Mamani. I'm Hub Director for the Health Tech Hub Africa. We want to start this session that really largely focuses on scaling innovations in the public health sector to transform our existing health systems. Today, we have the Honorable Minister for ICT, Honorable Paula Ingabire. I hope I've said your name correctly. She's going to give us a keynote. And I know we are short on time, so allow me to invite Honorable Minister Ingabire to come give a keynote, and then we'll proceed to begin the session. Honorable Minister.
Distinguished guests, partners, investors, researchers, and most importantly, the innovators that are going to be showcasing their solutions in this session, good morning. Africa's health challenges are very well documented, and I believe in the last, yesterday, most of us have been in sessions that have been discussing the various challenges and what we're doing to solve them. And so many of those range from a rapidly growing population, limited healthcare infrastructure, and disproportionate burden of disease. Yet within these challenges lie unprecedented opportunities. The proliferation of the mobile technology, the expansion of internet connectivity, and a burgeoning tech-savvy youth population all provide fertile ground for digital health innovations. Across Africa, we've proven that ingenuity is not our constraint. The real test is at scale. Whether brilliant ideas can become reliable public services that reach every clinic, every community health worker, every mother, and every child. Today's plenary is about that journey from startup to scale, from promising pilots that we'll see to the everyday backbone of our health systems. Pilots don't save lives, systems do. The question before us is not whether African innovators can build world-class health technology, because they already are doing that. The question is how we as governments, partners, funders, and delivery partners make these solutions a part of the everyday fabric of public health. Today we are going to spotlight innovators from the 2025 Health Tech Hub Africa cohort. Each is going to be receiving catalytic seed funding from Endless Network. However, I hope that we all understand that as we spotlight these 9 innovators, that it's not just about admiring their prototypes, but an opportunity for all of us as partners to clear the bottlenecks that stand between promising tools and routine use in clinics, hospitals, and national programs. We meet at a moment of urgency and opportunity. Urgency because health outcomes stall when last-mile delivery is weak, when data sits in silos, and when frontline workers lack the necessary real-time tools. Opportunity because digital public infrastructure, from digital IDs to payment rails to data exchanges, is maturing across Africa. If we align innovation with that infrastructure, we can bend the curve on equity, cost, and quality when it comes to healthcare systems. Our theme is innovation not for the sake of innovation. It's innovation for systems transformation, so that a mother in a rural village can complete antenatal care journey. A nurse can trust an electronic record that it can be accessed in offline mode. A district pharmacist can see that stockouts as they happen, and a national program can pay for outcomes and not just activities. Let's talk about some key principles that should guide some of these digital healthcare solutions, some that we'll see and those that we'll continue to support as partners. The first principle is equity by design. If a solution does not work in low connectivity settings, in our local languages, for low literacy users, it's not ready for public systems. Our benchmark should not be the best hospital, but it should be the most remote health post. The second is safety and trust. Innovations must uphold clinical governance, data protection, and patient rights. We must champion clear data use agreements, consent models, and role-based access so that trust becomes an accelerator, not a barrier for adoption. The third principle is around interoperability, not isolation. We must commit to open standards so that innovators plug into national registries, health information exchange systems, supply chains, and payment systems. Scale is integration. Last but not least is sustainability beyond grants. Public systems need predictable models, framework agreements, managed services, outcome-based contracts, and reimbursement pathways. The business model of each of the solutions that we'll be listening to today must survive beyond the grant, and so must the service that they provide. But when we talk about scaling, which is our theme today, it's more than these innovative ideas that we'll hear about, that we've heard about, and that we'll continue to hear about. On the government side, we commit to being an enabler and not a gatekeeper. And concretely, what that means is that we'll be a single front door for innovators to integrate with national systems and access documentation, sandbox experiments, as well as technical contracts. Regulatory sandboxes are things that you're seeing. As Rwanda, we've not been left behind in putting in place similar sandboxes that will fast-track approvals while maintaining safety and time-bound, transparent criteria. We also need a clear evidence pathway from baseline to pragmatic evaluation, co-designed with independent researchers. A procurement playbook that includes contracts, managed services, and outcome-based options with guidance on total cost of ownership. And lastly, data user agreements, privacy standards that protect citizens while enabling innovation. And now let me turn to our innovators. Over the next hour, you'll hear investor pitches, you'll hear scaling stories, how each is adapting their products and operations to public sector realities, aligning their priorities, engaging communities and local champions, generating evidence that matters to program managers, and building operational muscle to serve the different locations reliably. But I hope that we can also be practical as we listen to them. I hope that we can leave this room when we've removed the barriers, or at least have a plan on how we remove the barriers beyond just discussing them. Scaling digital health is not about apps. It's about dignity, it's about access. It's the mother who does not miss her visit because a reminder came in time in a language that she understands. It's a pharmacist who never has to say we've run out of any product because the system saw the demand before she did or he did. It's the data analyst who turns real-time dashboards into better staffing tomorrow morning. And it's a ministry that buys what works because the evidence is clear, the standards are open, and the partners are aligned. So to our 9 innovators, thank you for choosing the hard path, adopting and adapting products and business models to serve the public. To Endless Network, thank you for the catalytic capital that unlocks real bottlenecks. Let's turn great startups into standards of care. Let's turn momentum into measurable outcome. And let's build health systems worthy of the people that we serve. Thank you and congratulations to Health Tech Hub Africa innovators and to the Endless Network for catalyzing this next chapter. Thank you very much.
All right. So at the Health Tech Hub Africa, we support innovators to scale their solutions to the public sector or access governments as a client. And like the Honorable Minister has mentioned, we do provide catalytic grants, often funded by different partners, to support these innovations, demonstrate their solutions in the different public systems in the different markets that they operate in. So this year we have 9 winners. You might have gotten a pamphlet or a printout on your seat. The 9 innovators, more details of that is actually provided in that pamphlet. You can go through that, but you will meet them in our panels today. And so because of that, today is not going to be a pitch. Rather, it's going to be an opportunity to hear from these innovators on their ambitions to scale within the public sector, the challenges that they face, and the support that they need, if any. Before I proceed, I'd like to introduce my 2 colleagues, Wilfred Njagi, who's the co-founder and CEO of Vilgrow Africa, but also a senior advisor to the Health Tech Hub Africa, and my colleague, Joan Peter, who's the Director of Innovation at Jopaigo, and also senior advisor to the Hub. These 2 will be my co-moderators today. They will be leading 2 panels where you'll get a chance to hear from the 9 startups. And you will appreciate that scaling within the public sector really takes a whole village. And because of that, we have invited other key stakeholders in the ecosystem to be part of a stakeholder panel that is going to provide feedback and ask questions to the innovators as they talk about their ideas today. And I'd like to take this opportunity to invite these key stakeholders. As I read their names and introduce them, please, I request that you stand, turn to the audience and wave so that they can see you. So from the Ministry of Health, Rwanda, we have Andrew Muhire. Thank you. And from Steel Foundation, we have Joe Exner. Thank you, Joe. We also have Michelle Monroe from the Global Fund. A round of applause. And from Novartis Foundation, we have Sarah De Rose. Thank you. From the William Davidson Institute, we have Wendy Taylor. And finally, from Siemens Healthineers, we have Ibrahim. Thank you, Ibrahim. All right, so at this point, I'd like to invite on the stage the first panel that will be moderated by Wilfred Njagi. We'll have 5 entrepreneurs from the 9 that have won the Innovation Challenge this year. And again, a huge thanks to the Endless Network for providing the funds to these 9 startups. So Wilfred Njagi, please come to the stage. And you will be accompanied by Festus Hirwa from Dynasoft. That's the first company. We'll have Yemi from Drugstore Nigeria, Dr. Rasha Radi from Shefa in Egypt, Aaron Ogunda from GG Health in Kenya, and Dennis Maure from DPE in Kenya. Thank you so much. Over to you, Wilfred.
Thank you, thank you. Great. It's wonderful to see you all in the audience and to have our innovators up here. It's because of innovations like this that we have a summit like this, right? There wouldn't be a Africa Health Tech Summit without health tech solutions. So our panel will be piggybacking a lot on what Honorable Minister has just said when it comes to how do you align innovations to infrastructure. I like what Minister said, that aligning innovation to infrastructure is one way we can bend costs and overcome barriers. So in this first panel, we'll be looking at how do we align our innovations to the public sector infrastructure and try to integrate with what already exists, right? Because you cannot innovate in isolation. So I'll give you each 60 seconds to introduce yourself and your solution, and then we'll go to the next round of questions. So maybe I'll start with my far left. Please go ahead.
Great. Good morning, everyone. My name is Dennis Maure. I'm the CTO of a company called DPE. It stands for Digital Patient Engagement. We are based in Kenya, and we work a lot within the public health system to support health systems to engage people, capture feedback, And we do this through an AI-supported platform that ministries and NGOs and donors and also insurance and payers use. Thank you.
Thank you.
Go ahead. Morning, everyone. My name is Aaron Ogunde. I come from a company known as Gigi Health back in Nairobi, Kenya, where I serve as the co-founder and CEO. What Gigi Health does is that we provide affordable digital solutions to healthcare facilities, healthcare workers. This includes patient management solutions, blood administration solutions, and e-learning platforms. Thank you very much.
Good morning. I'm Dr. Rasha Rodi. I'm the co-founder and COO of Shifa. We are Egypt-based. Basically, we have built a mobile app that is GPS-enabled, AI-powered, to help patients order, schedule, refill the recurring prescriptions from the nearest verified pharmacy, closing the gap on compliance by improving accessibility and affordability. We also leverage the power of data and analytics, since we now have access to sell out and sell in data, so we can help the industry stakeholders serve the patients better to even close the gap on compliance better. This is our North Star. We have been operating since 2018. Recently expanded to the first GCC company, Saudi Arabia. And we're looking forward to learn more about other African systems so that we can have a reasonable plan to expand to there too. Thank you.
All right, good morning, everyone. My name is Yemi. I'm co-founder and CEO at Drugstore Nigeria. At Drugstore, what we do is we digitize pharmacies, and we do this in order to improve access to medicines in Nigeria. What we do then is leverage on this data to provide support to health insurance companies, to hospitals, and to end users to find affordable and life-saving medications. And we've been doing this for the past few years, and I'm looking forward to meeting partners and government officials as well as we scale.
Thank you. My name is Ilwa Festus, the CEO of Dynasoft Limited, a company based in Rwanda. Our flagship product is Medisoft, which does digitalization for health facilities, public and private, as an electronic health record system enhanced with AI functionalities. We started in 2014, over a decade now, and we have served more than 100 health facilities. Thank you.
Thank you. Thank you. Let's appreciate all of them. So we now have an impossible task of going through the panel in like 10 minutes. So keep the same spirit of brevity and straight to the point. And the first question will go to Dr. Rasha. I would like you to tell us, as you work to adopt your solutions to the public sector, what have you learned about aligning innovations with government priorities and budgets, especially?
I have to say that I cheated a little bit because I'm already a lecturer of pediatrics at Cairo University. So I teach, and I've been working with the insurance as a consultant. So I had to take a deeper look, try to understand what they need for a year. And I discovered that what we have built so far can bridge the gap in much, much shorter time, because what they need is improve accessibility, track, monitor, digital feedbacks, and their needed analytics to further build the blueprint for future R&D and make decisions. And this is basically what we are doing already, because we have weaved this fragmented market into digital network at the fingertips of patients across Egypt. We have access to the sell-out and sell-in data, predict the stock needs for our partner pharmacies, support them with the needed analytics, support pharma companies, and get digital feedbacks. But one thing was missing. We didn't know the readiness level of the government digital methods and how we can adapt to that. And that what took us like a year going back and forth, understanding more. And now we have 2 tracks of operational flow that can fit the government's need and tech readiness, whether it's going to be e-prescription based or hard copy, they're not ready for it yet. Is it API based, or we can do non-internet based or IP address? So whatever the tech, now we are ready because we have been exploring all the different levels of tech readiness, so we can adapt to that and be part of this new system, and then use the data and analytics to help them further build and draw the blueprint for the next R&D.
Thank you. What I hear is data-based decision-making, and also being able to assess the readiness levels and adapting accordingly. Speaking of readiness, I just remember that we have one tool called a public sector readiness checklist that anyone who wants to read about it is a publicly available tool, and maybe Manuel, people can get in touch with you, because we waste a lot of time when we are not able to assess the readiness level, and only to be stopped at the tracks when you're trying to implement in a system that is not ready. So thank you for sharing that. The next question goes to Dennis from DPE. I'd like to know, what challenges have you encountered when trying to scale within public systems, and how are you working to overcome them?
Thank you for the question. I think challenges are many, but the whole thing about being an innovator is that you relish working on challenges, because innovation is actually the art of the possible. The biggest challenge that I see outside of the systemic or structural challenges that exist that sometimes are outside your control is how you're able to stay true to your, let's say, product ethos or a specific innovation thesis when you're running against a much slower system, and how you're able to manage your time and energy and capital effectively to be able to do that. So most of those challenges are more or less maybe not seeing the policy tailwinds properly, innovating against the wrong policy at the time that doesn't have the right momentum. So one of the things that I've learned is to always synchronize the national strategies into the roadmap. So policy first, then product second. I think that's really what I've learned and how I look at all these challenges. Yeah, thank you.
Thank you. I like that, especially when you say how you effectively manage time, energy, and capital. We all have the same amount of time, same amount of energy probably, and maybe capital is where we might have different capital sources and capital types. But how you manage that effectively and aligning with the government policies so that you're not wasting your energy or your time, because those two you really can't recover. So thank you, Dennis. The next question now goes to Yemi of Drugstore. And Yemi, I'd like you to tell us, looking ahead, what kinds of partnerships, evidence, or ecosystem support would be most valuable to help you succeed in scaling your innovation across public sector?
All right. I would split that question into three. From support, we have government support, ecosystem, then we also have research institutions and analytics. For the ecosystem, we are working with companies, associations in Nigeria like the ACPN, the community pharmacists, and so working with them as well as working with the National Association of Patent Medicines will help us scale, because then we are able to onboard large number of pharmacies and health shops. The more pharmacies that are onboard, the better data that we are able to give the government to make decisions in real time. And secondly, for government support and partnerships, we are still in discussion with the Pharmacy Council of Nigeria, and we also intend to take that discussion to NAFDAC. So because these are regulators that need data and insights into what is happening in the pharmacy level. And then lastly, the kind of support that we need also with research institutions and data companies like the PBR Insight, for instance. So we work with companies like this already, but we plan to work with more. And then when we work with these companies, they're able to break down the data to make decisions or to make meaning of the raw data that we generate from pharmacies.
Thank you. So looking at how to gather insights to help you form better decisions. And I think we are all inspired by the national intelligence center here in Rwanda as an example of data and insights for decision making. Yeah, so thank you for that. So now moving on to Festus of Dynasoft. How are you navigating interoperability within the existing government systems?
Thank you. Thank you. This is interesting, interoperability, because it fits well even with the theme of the summit, connected care. Yeah, so to understand it well, we need first to think about the cost, not just in terms of money, but in terms of lives, when the systems don't talk to each other. And that's when interoperability kicks in as the ability of the health systems to exchange data so that that data can be used effectively, securely, and seamlessly. Now, in Rwanda, we have many systems to be interoperable with. So to understand this well, let's take a patient at the health center and give him or her a care to see how the systems interact for that care. If a patient arrives at the reception, the first thing to do is to do registration. For that, we need a UPID, Unique Patient Identification. First system, National Identification Agency. Second, we need to check if the patient is eligible for insurance. Another system, we need to check eligibility. And next, the patient goes to a doctor or a nurse. There, that health worker needs to check the past records of the patient. And that is another system, which is HIE, or generally Open HIE. It helps to access the past records of the patient. Now, if we need to do prescription for the patient after treatment, after discovering or getting to know the diagnosis, we need to do prescription. Another system, e-prescription. The EMR or EHR has to interact with the e-prescription system so that the patient, when he or she goes to the pharmacy, the records will be there. Now, the next thing can be to do billing, insurance billing. Another system, Rwanda Health Insurance Portal, to do the billing, the claims recording. After that, our patient, everything he or she has to do was completed. Now we go to the reports. Another system, HMIS or DHIS2. The system has to interact with the system to generate the reports. But it's not all. There is another system, National Health Intelligence Center, for the government to see national dashboards, everything. Now, the landscape of that interoperability is both challenging and rewarding. It's challenging because dealing with these APIs, interconnections, everything, sometimes the systems don't talk to each other. They're just there, they look at you, they keep quiet. Now you have to deal with it. But finally, the connections happen. And it's really rewarding, satisfying. We are seeing the impact on patients, on health workers, on public sector, because they can monitor everything. So with Medisoft, we have achieved around 80% of that interoperability. And we did that because we got a support from the Ministry of Health. I'm grateful for them, and I'm lucky here there are many members of the Ministry of Health. If you can join me to really give them a round of applause. Yeah, because they're helping, they're helping to organize testing sessions. Can you imagine that? So that innovators like us don't get lost in the jungle of APIs. I think if you've been there, you know what I mean. Thank you.
Thank you. I lost track of how many systems you're mentioning, so clearly there's a lot. But as we heard yesterday, it's not enough for systems to talk to each other, but even the people involved, and I think that's where the sessions you mentioned really come in handy. Right. So now the last one before we turn over to the expert panel goes to Aaron of GG Health. Sorry, I still remember your previous brand name, Damusasa. But Aaron of GG Health, maybe you can tell us how easy it has been to understand and align with regulatory requirements in Kenya.
In terms of how easy it is to understand, very easy, because most of them are written in English, so usually it's very easy to understand. I think the challenge comes in when now you're trying to do the alignment. So a good example is, like back in Kenya, health care data is supposed to be housed within the borders of the country. So it's very expensive to get the AWSs, the Microsoft Azure, who actually have, set up base in Kenya, and it's very expensive. So it's almost like, when you tell me to align to something, have you facilitated me to align to that thing? So right now, I'd say it's, a process of both progress and pain at the same time. I say progress because never have we seen before a government that has very huge appetite for adopting innovation. Right now, we've seen innovators be called to policy framework formulation sessions, different county governments adopting innovation as well. But then the pain part is when, it feels like right now it's more personality driven as opposed to system driven. And I say that because sometimes the approvals vary from office or department to department. In one department, you sail through very quickly. In a different department, it's almost slow. So I think that's where we are in Kenya. So the easy to understand, a bit of challenge in aligning. Yeah.
Thank you so much. And I like that parting shot. Yeah, sure.
Because the regulation, for example, in Egypt for the pharmaceutical sector was put back in the 1950s. There was no internet, there was no mobile phone back then. So when I think it's part of our job as innovators is to anticipate that there will be a wake-up call. So when you build a product, it has to tiptoe around what's going on now, but this will change, so that you have to be flexible enough and you have to be resilient. And I think now in Egypt we have new licenses coming up, and they always give you a period of grace to adjust. So this is how smart you need to address this, is that because you anticipated this will happen, you have to be on top of the grace period and try to do this. So this is part of the job of the innovator, to anticipate. They have to have a wake-up call. So build your model as there will be a wake-up call.
Absolutely. And as they say, policy always catches up with innovation. Innovation is always ahead. So don't be afraid to break some of the laws, but policy will catch up with you, hopefully, because some of these things are hard to navigate, especially. Exactly, a law that doesn't exist. But when you look at challenge, especially around what Aaron was talking about, hosting data locally and the cost, it's so hard to navigate for an innovator who is bootstrapped, and you're putting a requirement that almost it makes it a no-go. But we are lucky that, as you're saying, Aaron, that government is now, policymakers are willing to listen, and mostly it comes down to the people in those offices that you're able to. Now, switching over to people, let's now switch over to the expert panel. I don't know how many minutes I have. 7. Okay. So we'll take a few questions, not all. We might not get all of them, but I know Joanne's panel after this will consider the rest. But maybe I'll take the first 3 and then look at the next set. So anyone, please go ahead.
Good morning. My question is for Dr. Rasha. You have, by all accounts, built a tremendous business in Egypt, solved lots of problems. Looks like you've got really good momentum in Saudi Arabia. In addition to capital, what challenges do you think you face? What support do you think you're going to need to expand to Rwanda, for example, or other African countries?
When I said that it took us a year to understand the tech savviness and readiness of the government so that we can adapt to, if this can be shortened to not a year, because we don't have all this time, yes, we need network connections. We need to be in a room where we have a meaningful conversation, asking the frank questions right ahead, telling them, and what's your problem? And I'm sure I can adapt and adjust to fix it in a way that meets your requirements. This question, it took us a year in Egypt. If we can have a faster answer with other African countries, we believe we can adapt and build the solution or do some tweaks in the already existing solution to fit the tech savviness of different African countries, especially that we know that it has to be built into phases. You can't just copy-paste anything in live. So, for example, in Egypt, we're starting now with a flow that we started in Saudi Arabia, but it seems it fits perfectly the technical and the security requirement of the Egyptian government. So we're offering them that. It's very easy, it's already here. But if we come to Kenya or Rwanda here, I need to know the minimum bandwidth of internet that may exist in what country so that to make sure that my technical solution can actually operate. And I know that there are ways to make it work, but I need these answers frank on. Yeah. So connection, networking, meaningful meeting settings with the questions that many people try to avoid, but we need answers to move fast and execute, because we are executors. That's it.
Thank you.
Yeah, let's take one from Ibrahim.
Yeah, my question goes to Dennis. How do you measure behavioral change and long-term impact of your campaigns? And the second question, can your platform be linked to diagnostic centers and vaccination services? Thank you.
Love the question. Thank you. I'll start with the second one. Absolutely. Our entire approach is actually a white labeling approach. So it's all about building the necessary intelligence for such solutions. And what our research and actually current exploration that we're doing is how our platform is in fact CDS. It's also a clinical decision support, only that it's linked to the community where the real insights exist. So it's quite an interesting intersection. And your first question is also quite interesting because how we learn, first of all, what we have done is to try and understand what is the appetite, for example, of let's say the 5 counties that we've rolled out our solution to. One of our first ways that we learned what the impact of our solution wasn't through traditional social ROI modeling or anything, is that one of the county officials told us that they had stockouts in the health centers because we had messaged that the community needed to go to the hospital. So it was a completely proxy indicator if you think about it. If you sit with them and you have very fancy Excel sheets, sometimes they don't translate to what is conversion to them, which is actually people going to the hospital when they've been told to. So that sort of nudging is already showing that there's great growth. Then there's also been appetite to use our platforms for World Health Days. They really consider that as really the most almost national promotional days, if you think about it. So there's incredibly big interest in that, and they absolutely love their low-tech approach. But I think what really crowned it was how we were able to wrap the whole solution in a way that they could understand, because your typical health manager, in Kenya is devolved, so within the devolved units is not a very digital ICT-centric person. So you really need to think about opt-in solutions that are almost as simple as mobile money. And that's where you find that there's complexity, because how do you distill systemic thinking into just simple 2-3 workflows? And I think the last thing is also helping them capture data that they are not able to capture. Because I think data is where the stickiness is rather than the applications. Yeah.
Thank you. I think we'll take one more. Sarah?
Can you hear me? Yes. So my question is to GG Health. I'm wondering, in your interactions and partnership with the government in Kenya, what are some of the data points that you have put forward to demonstrate impact of your solution? We know how much impact is important in the demonstration to government, and I'm wondering what it is that made the difference for you specifically.
Thank you for that question. If you look at one of our solutions, which is Damu Sasa, which is a blood services administration tool that helps hospitals connect to one platform and share, exchange blood products. I think for government, it was mostly looking at how many mothers and children and other types of patients get blood products on time. So there's a term known as hemovigilance, which is like surveillance of the entire blood services value chain. So for them, it was being able to see what is happening in real time in different facets of that value chain. So how many blood products have been screened, for example, how many have been found to have different TTIs, and how many patients have been called back, for second checkup. So for them, that was the strongest point in order for us to actually even have a conversation about partnering with them, because this is data that did not have. Most people had to write, papers and send them to government offices. But now with our solution, you're able to get this data in real time. For example, you're able to know how much blood is in the country or in a certain county or in a certain hospital in real time.
Thank you. Maybe we'll take one last. Okay. I wanted to take one from the audience as the last one, but let's take last from Andrew, and that will be the last one.
Yeah, my name is Andrew Buringa Ingelheim. Straight up question. Is there enough capital in the ecosystem that has enabled you to prove your solutions, especially when it comes to working closely with the government? This is a capital question, and it can be to anyone in the crowd. Thank you.
Anyone?
Capital? Okay, if there is capital, yes, there is capital. But when you agree on receiving capital, it's a written and an unwritten contract with the person or the entity providing you with this capital on how you're going to use it. And here's where we may differ, because people have different priorities. So there is capital that you need to find, the capital that meets your priorities, so that the long-term relationship that you build with the capital provider actually works. And in Egypt, we have the word that it means when you get money with capital from someone, it's like marriage. So you have to be good to your husband or wife forever. No one loves a divorce.
Yeah. So I know we've run out of time. Thank you all. There's another panel. I see Joanne giving me a signal because there's a next set of innovators. So let's appreciate these wonderful champions and heroes of. Joanne and the next set of innovators to come to the second set. Then we'll have a group picture at the end with all the 9. Thank you.
round of applause for the last panel. Thank you. Now we have another excellent panel. If the last one focused a little bit on aligning with standards and operability in existing systems, this group of innovators will focus a bit more in their conversation around expanding access to care through community-based models and diagnostics. So we're going to start again on the end with you, David, moving across closer to me. Let's give you around 90 seconds to please introduce yourself, your organization, and tell us about some of what you're doing in the public sector. Go ahead.
Okay, so my name is David Addo. I'm a pharmacist, co-founder and chief product officer of A-Chemist. A-Chemist is a tech-enabled pharmacy chain back in Ghana that enables patients to have access to medicines at affordable cost, and also ensures that these products are used effectively. We have partnerships with a lot of organizations locally and internationally. Annually, we serve close to 360,000 patients, and we hope to do more as we scale. Thank you.
Thanks, David.
Good morning, everybody. My name is Adam Boxer. I'm co-CEO and co-founder of Doc Glasses. Doc Glasses is aiming to tackle the largest unmet disability in the world. There's 1 billion people in the world who need glasses and don't have them. I've worn glasses my whole life, can't imagine life without them. Our solution is simplifying the entire process of testing people's eyes and distributing glasses. This is basically an eye care business in a bag. You have everything you need in here to be able to test somebody's eyes and assemble glasses for them. The initial cost of it is just $100, including 20 pairs of glasses and all the lenses you're going to need, and we can train a primary healthcare worker, like a nurse or a clinical officer, in 3 days to do the process. And as the Honourable Minister mentioned, you need solutions that work for the most remote, the most rural health facilities, and this is exactly it. Our average retail price for a pair of glasses, including the frame and the lenses, is just $5, and that's including distance glasses as well. Normally, everybody's first question is, okay, if they're just $5, they must be pretty crappy quality. My favorite thing to do is to throw the glasses as a wall, but as I don't have a wall, I'm just going to throw them into the air. They're nigh on indestructible. I would have done it with mine, but I really can't see without them, so I wouldn't have been able to find them.
Thank you, Adam. Go ahead, Beverly.
Hi, everyone. My name is Beverly Senda. I'm the founder of Panacare. And what we do is we work with clinics and specialists and community health promoters to assess patients above the age of 40 with chronic illness. So we began with diabetes and hypertension, specifically for the older age groups. We all understand the difficulties of the older parents when it comes to getting access to specialist healthcare, especially when they have chronic issues. So we bring them the healthcare closer to them in the rural communities. And using our method, working with clinics, they're saving around 60% of their healthcare costs, and it's making an impact.
Good morning, everybody. I'm called Dr. Atish Shah, founder of Rover Labs Tanzania, and we make customized 3D printed assistive devices for people with disability. And our unique value proposition is we can do this remotely. So there is no need of any high-tech scanners. We use the iPhone front camera, which has the LiDAR. And all the workers, many health workers actually use iPhones now. They're quite ubiquitous. And once we train them, and training takes just an hour. So basically we train them, and we train them to take a good scan. And once they've taken this good scan, they send it to us via an email or WhatsApp. And we have a centralized facility in the capital of Tanzania, in Dar es Salaam, where we have our 3D printer. So once we receive the scan, we modify the scan, we model it, and then we 3D print it. And then we ship it back to that person wherever he is in Tanzania. And so we have decentralized the process of making assistive devices. And we also use generative AI to make these devices more lighter and more optimized, so they can take these the stresses without necessarily being very bulky. This also saves us material costs to make these devices. Thank you.
Right, so all of you have got aspirations to scale within the public sector, and we've heard from the last panel about some of what they have learned and some of the challenges that they have faced. So let's hear the same from you. I'd like to first ask, what have you learned as you have worked to adapt your solutions for the public sector? Things like aligning with government priorities and existing systems, budget and procurement cycles, etc. So who would you looking at me there? Adam, would you like to start first on that question?
I think it's, really important to understand what the priorities are of the government or local government that you're working with, because it can differ quite a lot versus central government versus local. One of the things we find that's really important is finding kind of a champion within that Ministry of Health or within that county government that is going to drive things forwards for you. And sometimes it doesn't even have to be the alignment with the overall Ministry of Health objectives, but it can be alignment with that champion's objectives, and they can really push it forwards for you, because all the solutions of all the startups we have in the Health Tech Hub Africa Accelerator are aligning with most of the Ministry of Health's goals. So it's about finding that person that's really going to champion for you.
Said over and over again by different innovators, the importance of finding that champion. So is there anyone else in the panel that has had a similar experience? How do you find the right person?
I think you, first of all, have to understand the issues on the ground. Once you have understanding of the issues on the ground, you should be able to identify the key players within the system who have been tasked to achieve that goal of solving the problem. And sometimes the solution is not quite obvious. You have to come up with innovative ways to go around it. And that is exactly what you have to do. In my case, I try as much as possible to make myself available in policy decisions making. So in that space, you find me working with government authorities, key ministerial appointments and stuff like that. So in that case, if there's any issue that needs to be solved, at least I know the right person to deal with and to get it done as quickly as possible. So you have to be involved. You have to play a key part in policy, and you also have to make sure that you serve the interest of the ecosystem as well.
Thank you, David.
Thank you.
Perhaps let's go to you now, Beverly. Tell us a little bit about what some of the challenges are that you have experienced.
So we do understand working when it comes to the government is not exactly easy, right? We've talked about the long procurement cycles, which is a challenge in itself. However, I want us to take us back. There's a challenge we faced recently in Kenya in mid-September, whereby there's a county called Siaya County in Kenya, and they had to fire over 300 healthcare workers due to poor hiring systems. Now, us as PanaCare, we work with community health workers. If we rely on the government when it comes to the same people who are supposed to provide healthcare services to the patients that we serve, and we depend on them to hire the right people, you see how that draws us back as a startup. So that means we have to go back and look at the cycles and how they hire, and it's not as easy to embed ourselves in such systems. So that's one of the challenges. However, let me push forward to my recent point on procurement cycles. When we got into a county called Homa Bay County in Kenya, we had to understand the planning cycle. So we sat down, we were like, where are you when it comes to NCD crisis, and what are you doing currently, and how can we help you achieve what you want to do long term? So right now, when it comes to every year, when we want to work together, we have to understand where they are and how we can assist them. And it's very easy, mostly when you work together, and also we receive feedback from the community health workers who they really rely on, and those are the people who tell us how to improve better. And it's easy when you're working on a system that is providing adoption based off the feedback of the patients and the community health workers together.
Thank you, thank you. Anyone else want to chime in on that question? Yeah, go ahead. Let's have Atish first. Thanks.
Hello. Yeah. So the main challenge that we had, when we are engaging doctors or community workers or even government officials, is first of all the awareness. So people are not really aware of these devices, especially pertaining to what we do. And we really need to create that awareness, right? So it's just not a matter of going to the market and, and selling these devices. One is, and very important, that's awareness. So we have done this through, group discussions. We have invited people to events. We have demonstrated, how these devices are made, what they are supposed to do, what gaps they bridge currently. Second is trust in the adoption of the technology, right? People don't know what 3D scanning is. People don't know what 3D printing is. And, we really have to push ourselves for them to understand what this technology is and what are, what are the advantages of this technology and in adopting them in a country like Tanzania. Thank you.
You had also wanted to come in, Adam? Mm-hmm.
Yeah, so I think we've found the biggest challenge with working with government is a very big disalignment on timelines. They work at much, much slower speeds than startups. Startups want to move quickly, we want to get stuff done, and we also need revenue relatively quickly because we're young entities. So we can't be reliant on ministries of health and government as sole revenue sources. Because they just move so slowly. So we see them more as an option value and an opportunity to scale into, but not reliant on them because of that timeline difference.
Thank you, thank you. Yeah, go ahead, David.
I would say some of the challenges that we've had with back in my country is that sometimes the public health system is much behind us. So we are much ahead of them, and there are no systems or frameworks in place that help for us to align properly. So it's like we do it as and when the situation fits, and when we all kind of have a situation where we can work together. And that has been a drawback because it means that we have to go at a slower pace, and we also have to, as was said previously, we have to kind of work outside the scope of existing legal framework because there's none available. And as we work with them, we try to shape up the whole ecosystem and get something out of it. So it's quite challenging when you don't have a clarity in place for you to work with.
Right, well, we're in a room packed full of people representing all sorts of different know-how, access to networks, opportunities. I'd like to ask you what sort of support you're asking for in helping you to scale in the public sector. So you've spoken about a number of challenges, building awareness, aligning with government cycles, the absence of a legal framework, differing timelines. A number of these challenges have been raised. What sort of support do you need to help you in this journey? Not just in the form of investment, although we know that that's always a kind of support people are looking for, but other kinds of support from other stakeholders. You've got a captive audience here. Let's have them hear how they can help. Yeah, you want to go, Atish? Go ahead.
So networks and connections to key decision makers. I think, you cannot find any one person who is a key decision maker. It's a whole host of people that you need to convince. And, if we can get those connects, the right connects, to such people, and they're just not from the government, right? They are from, from the NGOs, all the stakeholders, basically, that can influence partners and government, institutions. So yes, thank you.
Anyone else want to come in? David, go ahead.
Yeah, partnerships. I think Eight Chemists have come far with partnerships. We've had partnerships with various organizations. We've had partnerships with Microsoft for startups. We've had partnerships with Pfizer, Business for Health Solutions. We have partnerships with Harvard Business School. And all these partnerships have been very beneficial for our growth. And we would like to have more partners, and as we scale across Africa. So, we welcome everybody that would like to work with us in solving the problems that are on the ground. That's mainly access to medicines and pharmaceutical care. Thank you.
For me, I agree with partnerships, and I agree with my colleagues here when they say working with people who are in the field of healthcare and innovation and getting funding. But I also believe in getting partners who are aligned for us with providing healthcare to those who have chronic illness. There's many organizations which have a strategy when it comes to providing NCD healthcare services to patients. So also aligning with people who are doing such things, like we know who has a sector for diabetes and hypertension, right? Aligning with such partners creates having like an entire ecosystem where we're all doing the same thing. We just plug into different ways of providing healthcare.
Thank you. Go ahead.
So I have two asks. We have about 500 distribution points across Kenya, Uganda, and Ethiopia. And then we have pilots in Rwanda, Tanzania, Somalia, South Africa, and Ghana. So we're looking for more distribution partners in those pilot countries. Anybody doing any form of last mile health distribution, running health centers, dispensaries, pharmacies as well in those markets, who might be interested in incorporating Doc Glasses into your health facilities. And then the second ask is we're looking to expand across Eastern and Southern Africa and looking a little bit more now at West Africa as well. So introductions to any potential distributors in those markets and champions at ministries of health in those markets as well. Thank you.
I think I'm your first partner. So I would like to discuss with you on how we can get something done in Ghana. So you've got your first partner sitting by you.
You saw it here, folks. Wonderful. Let's turn now to our stakeholder panel. All right, great. Let's have Wendy, and then we'll have you afterwards, Michelle. Thank you. Go ahead.
Great. So my question is for Adam and Doc Glasses. So you have a great model. I want you to, this is really a financing question and thinking about your journey as an entrepreneur and your total addressable market, where you're headed. So, and I assume you're really working on a high volume, low margin product, right? So can you just paint a picture for us of where you see that the types of capital you will need as you move along your journey, and ultimately what kind of, are you looking to attract more of the traditional venture capital, and will you have sufficient returns that could attract them, or are you perhaps looking for something else?
So I guess I'll start. The impact of glasses is huge. So there is different types of capital we can access, and most of the glasses customers are first-time glasses users. There's been studies done that show like a 35% increase in income when you provide somebody with glasses. There's very few things which have as high a return on impact as giving somebody a pair of glasses. That being said, our target is by 2027 to be selling 1 million glasses a year and have an EBITDA of 2.5 million by 2029. So we are looking to be a profitable business, and we see that as the best way of scaling. Our global wholesale price for a pair of glasses is just $2, and we make a 43% gross margin on that. So we can attract both types of funding, and I think it will really depend on the markets that we're targeting. So for some of the more difficult markets like DRC, South Sudan, Somalia, where we just started a pilot, the need is absolutely huge. Like, you can count the number of eye care workers on your fingers. And I think for those markets, because they're more risky, because they're more difficult, we'll look for more impact-focused capital. But then for markets like Ghana, Nigeria, Kenya, Tanzania, it's more traditional equity investments. And then starting from next year, looking at some debt options as well, because as you set up in a market, debt financing is quite good, and for working capital for stock as well.
Thank you so much. Go ahead, Michelle.
Okay, so my question is actually then narrowing back down into the public sector portion that you guys would be looking towards. So similar to the question that Joanne was asking of what type of support, but then also looking specifically at working with procurement, with public health sector procurement. So, and it's kind of a question to anybody of what are the types of support that you see in order to be able to engage or work effectively with the procurement? You mentioned the long procurement cycles, but in terms of other aspects, and you mentioned a champion, but is there more systematic ways of that support that could be useful? Or do you have ideas of ways for the public health sector to also adjust in some ways or make information more available so that you can work with the procurement of the public health sector? Or is that not an issue at all? But that's a question for you guys.
Thank you for your question. So pertaining to my industry, the cost is a major issue because we get our raw materials from Germany or the Netherlands, and it's quite expensive, right? Because you have to pay tax on, for us we procure filaments, 3D printing filaments. So if we can, so we're looking at manufacturing the raw materials in-house in the country. And we can do this by using recycled materials, right? So basically plastics, polypropylene with some chemical processes. So we can actually make an extrusion line in Tanzania, and that would reduce the cost by a factor of 3. So we're looking, some sort of an in-kind support where, we can have a full control of the supply chain and not really have to depend on raw materials from abroad. Thank you.
Does anyone else want to chime in on Michelle's question?
I think with the support, if it's to do with procurement, I think one of the challenges we've had with public sector is payment on time. It takes a while for public sector to pay us on time for medicines that we supply. We've had that experience ourselves. And if we can have a financing model that can enable us to be able to comfortably supply government and for us to run our operations efficiently without having to worry about when we are going to get paid. I think that if there's a model to tweak, probably we can look at it and take advantage of that so that we're able to offer the service that is needed to the public sector. So payment is key. I mean, it takes a while to get paid. In Ghana, for instance, it can take up to a year for the government to pay you. So if you don't have adequate working capital, doing business with government is going to be frustrating. And it is quite frustrating, actually. So we need that kind of a bridge, patient capital, or something that will make us be able to do the public good as well as ensure that business is also continued, sustained. Thank you.
We need to wrap very soon, but I'd love to turn to Andrew Muhere from Ministry of Health in Rwanda. Let's first just congratulate him on his leadership, which I know a number of innovators have mentioned. Thank you. Would you like to have the closing word? It can be a question or a comment, anything you'd like to offer.
Yeah, thank you. Thank you for allowing us to be in the panel, and it was really very good hearing from innovators. We've been working with them. They are right, they move fast, but we also move fast in the government. Also move fast, actually. I think the important thing is understanding on the priorities, because, my question was like asking innovators, how do they align their priorities versus government priorities? Because you may think I'm moving slow, but because maybe we have different priorities, that is something that we need to do. But for Rwanda, I think what we have done, we have all policies, environment that motivates innovators. And actually telling you the truth, without these startups, we should have not been here at the status we have now. He was saying that now they have covered 100. When you put it to 200, that is 300, it makes it even a bigger number. So it's achievement that comes back to us. But I think what we need to improve is making sure that what we do adds value. So because in the government, we buy values. We don't buy softwares, we don't buy systems, we buy something that the software is adding in what we do. So that is what I could add. For that one, I would like to thank you for this session. And I think the question is that one for priorities, how it's aligned with the government. Thank you. Yeah.
Would anyone like to answer that question? How are you aligning with government priorities? Okay, Tish?
Yes, thank you for your question. So in Tanzania, one of the government priorities is local manufacturing and then also digital transformation. And now we are moving towards universal health coverage. And what we do, perfectly aligns to that because we manufacture locally, so we reduce, the foreign imports of ready-made devices. We do take raw materials from abroad, but we don't, we manufacture in Tanzania. And the other thing is that, we use the smartphones, right? So, we use the smartphone camera. So it's already existing in the infrastructure, so there's no need to buy any new tech, any specialized scanners to enable frontline healthcare workers. Thank you.
Thank you. Unfortunately, I think that's all we've got time for today. Let's give them another big round of applause. Thank you, and congratulations on your Endless Network funding. I'd like to invite Emmanuel to officially close the session, and then I think we need to have a group photo of stakeholder panel and all our innovators.
All right, a round of applause to all our panelists. Great. At this point, I'd like to invite on stage all the 9 entrepreneurs and our esteemed guests, the 6 stakeholder panelists, to the stage. And our photographers to get ready for that group photo. So as they take that picture, allow me to say, okay. Ladies and gentlemen, we've come to the end of the session. Thank you so much for, again, participating and coming to this plenary session. We do appreciate you making the time for us. Throughout this session, Wilfred mentioned the public sector checklist, scaling checklist, and any other information that you might want to know from the Health Tech Hub Africa. We have a booth outside. If you want to learn more about the 9 companies, they will be at our booth. If you want to meet any of those companies as well, please do reach out to us or find them anywhere in this conference. Thanks once again, and I wish you a good rest of your day.